hello everyone, and welcome to our third staff town hall. We're so happy to have you joining us today. I'm Hallie Nicholson. I will be your moderator today, and I'm the Strategic Communication and Engagement Manager in Campus Human Resources. So we've got a great group of panelists today. We're going to share some information about our Return to Learn program and some other topics. So thank you to everyone who submitted questions in advance, and we also encourage you to continue submitting questions using the Q&A function. We've got a team of folks on camera and behind the scenes that'll be helping to answer your questions today. So we received a ton of great questions, and since we received so many, it's likely that we won't get to all of them today, but we will log the questions as they come in and post any new ones to the Return to Learn website, which you can find at returntolearn.ucsd.edu. I also want to acknowledge that we're in a time of ongoing uncertainty and quickly evolving situations. We hope to continue to be proactive and adaptive in all of our efforts, which means sometimes, and sometimes daily, our response to changing circumstances requires adaptation. So we believe UC San Diego has the qualities of flexibility, resilience, and giving our colleagues grace, and that's what we really need to get through this. So I'm honored to be part of this community, and I'm happy to be here with our panel. And with that, I would like to welcome Chancellor Pradeep Khosla for some opening remarks.
Thank you, Hallie, and good afternoon, and welcome everybody, and thank you for joining us today. I just want to take a few moments to update you on our Return to Learn plan, which involves incrementally populating our campus for the fall quarter. As you know, we've been stress testing our Return to Learn approach throughout the spring and summer on campus. So this spring, about 4,500 students lived on campus, and about 3,500 students lived on campus over the summer. And many of you and other critical function staff came to work each day. So thank you very much for being on the front line. Thank you very much for being here to support the campus and our students. Between March and September, we saw only a small number of positive cases that were primarily contracted in the community and not on campus. And since last Saturday, more than 2,274 students have been tested who are returning to campus during the move-in process. Of those 2,274 students, our testing protocols identified 2 students who are asymptomatic but shedding the virus. One of those is in quarantine at home, and the other has moved into our dedicated isolation housing, where we will care for them until they're cleared to return on campus. And earlier this month, wastewater monitoring identified traces of the virus in the wastewater outflow from the Revelle College area. In response, literally overnight, we put up testing facilities and tested more than 368 students and 279 employees. 2 employees tested positive for the virus and quarantined until they were cleared to return. The wastewater testing program is an important part of our monitoring strategy. It allows us to detect a virus 3 to 5 days before somebody becomes symptomatic and is actively shedding the virus. And this detection happens in fecal matter. So it tells me that our plan is working, and we have taken the necessary steps to make it easy for students to follow campus safety and public health guidelines. And as I walk around campus, I must share with you that I'm very encouraged by what I'm seeing around the campus so far. Everybody's wearing masks. In the last 4 days, I've only seen 2 people not wearing a mask out of more than 200 or 300 people that I've run into walking around campus. Very impressive. And I can tell, and we can thank our student health ambassadors, and we've hired more than 200 of them who have been specially trained to provide support and positive peer reinforcement. You probably have seen them walking around campus in their yellow shirts. We have also implemented a voluntary smartphone pilot program in partnership with Apple and Google that will increase the possibility of quick detection. And I sincerely, seriously, and strongly encourage you to consider opting into this program. It's called CA as in California, CA COVID Notify. This, I can guarantee you, will help keep our campus safe. And this will help us be prepared. So thank you, everybody, for your contributions and getting us to this point. You've been instrumental. You've been very resilient. And I take pride each and every day in everything you do for all of us. So let me just say, you are the Tritons that we all want to be. You are the Tritons taking care of our Triton community. So let me just say thank you and go Tritons. Back to you, Hallie.
Great, thank you so much, Pradeep. All right, now I'd like to introduce the host of our town hall today, our Chief Human Resources Officer, Nancy Resnick.
Thank you so much, Hallie. I am Nancy Resnick. I am very proud to serve staff at UC San Diego as your Chief Human Resources Officer. I really appreciate folks who've been able to join us today, and this is our third staff town hall. So it is great to virtually connect with so many staff across campus in so many different roles. We have a lot of information to share with you all today. We have with us a panel, as usual, of campus leaders and medical experts who will be able to provide us with up-to-date information about our Return to Learn program. And our Chancellor has certainly given some critical highlights to us in his opening remarks. We'll hear more about this, and we're seeing early indicators that are extremely positive in terms of our Return to Learn program. For colleagues who would prefer to receive information in Spanish, we will be providing a Spanish captioned video of the town hall, and it'll be available shortly after this event concludes. We want to make this event available and accessible to everyone. So I would encourage you to fill out our post-event survey, and please share your preferences in terms of what you would like for translation and captioning for future events. And we will take that feedback into account as we design town halls going forward. At our last town hall, I shared with you how Human Resources was exploring options to support staff working remotely in terms of home office setups. And we recognized and talked a bit about how with many employees continuing to work remotely, it's important to have a suitable home office workspace. So I'm happy to be able to share with you that we have a great update on this. We have rolled out new guidelines for how supervisors can support employees who are working out of a home office. Available options include bringing home equipment from your campus workspace, exploring our surplus inventory, and taking advantage of discounts that have been negotiated on equipment options. So please look into this if you're interested. You can learn more about it by visiting HR's COVID-19 resources on Blink. And this topic is particularly important to us in light of what we've seen in our preliminary data that's back from our Staff at Work survey. The Staff at Work survey results are still being finalized, and I expect that they will be able to be shared out in a week or so. But in terms of our preliminary look at data, what we've seen is overwhelmingly strong support for remote work from the staff perspective, as well as extremely strong support from supervisors. So this is very powerful data for us to have, and it will be important for us to utilize as we look forward to how to continue working in a highly effective and connected manner. Before we start the update portion of our time together, I want to thank you. I'll echo some of the words we heard from our Chancellor. I want to thank you for everything that you do to keep San Diego, UC San Diego moving forward. And we know that this year has been very difficult and challenging in many respects. And at the same time, I really see it as bringing out the best in us collectively and in our campus community. I continue to be inspired, and I feel very proud of what I see demonstrated by our staff every day. So we are, we're incredibly effective. We've kept campus going. Folks have come to campus every day and kept our operations going every day. We've reimagined the campus living and learning experience for our students. We've created incredible virtual events and so much more. So thank you very much again, everyone. Thank you for participating and for all the ways you're contributing to our success. And let's get started.
Great, Nancy, thank you so much. All right, so as we mentioned, our agenda today is kind of a two-part event. So we're going to start with some updates from our panelists, then we'll move into Q&A. So for our first update, I'd like to introduce Dr. Chip Schooley. Chip is the co-director at the UC San Diego Center for Innovative Phage Applications and Therapeutics and professor of medicine in the Division of Infectious Diseases and Global Public Health. I'd also like to welcome Pierre Ouillet, our Vice Chancellor and Chief Financial Officer. And together, Pierre and Chip will give us an update on the state of the pandemic.
Thanks very much, Hallie. It's nice to be here with you this afternoon. Look forward to the question answer section to follow. I'm just going to give a very brief update on kind of where things are globally and move towards San Diego, and then Pierre will give you a much more granular look at what's going on the campus. These are summary data from day before yesterday, and the main point to make here is that the US, as you've been hearing on the news, has moved forward beyond 200,000 deaths, which is a very bad thing for us as a country. More concerning to me on this graph, however, is that this downward trend we saw from the middle of July is now coming up again and is being driven mainly by the Midwest. And there right now is good evidence this will continue for some time. And there is speculation this number will be 50% higher by early January. So we are by no means close to being over this epidemic. Next. This shows you the situation in California. We had a bad late July, early August, but things have come down nicely since then. And we're now down to almost where we were at Memorial Day, but actually still not quite to where we were even then, and not where we need to be to really be able to open up things with more vigor than we are right now. Next slide. This shows you the San Diego situation. This is looking at the percentage of people who test positive in the San Diego County when they come in for routine testing. And what you can see is that we were coming down very nicely toward Memorial Day. Then we loosened things up, and then we had a summer of post-Memorial Day interactions, including activities, bars, restaurants, and other places, and drove ourselves back up to almost where we were at the peak of things at the end of April. We pulled back in the middle of July, and we're getting better until late August. A lot of this is being driven by San Diego State's reopening, which we can discuss in just a minute. This is a very important graph because this tells you what will happen to follow in terms of numbers of cases. This precedes cases and people showing up in the hospital by about a week and a half or so. The good news is we're headed back down again, and I think with this, we're seeing better control of things at San Diego State. Next slide. This is the county dashboard that is updated every day, and this is what drives what we're allowed to do in San Diego County based on the state's guidelines for individual jurisdictions. You can see here, this is the most important number, the case rate. This is the number of cases per 100,000 for the per day for 7 days, starting 7 days before now. By that, what I mean is from day -14 to day -7 from today, we were seeing 6.9 cases per 100,000. And anything below 7 keeps us in this so-called red zone, which allows us to do some things indoors, including bars and restaurants at limited capacity. We were up above 7 until about 2 days ago, driven by, next slide. This activity here that was occurring, bleeding into these numbers 7 to 10 days ago. These are 2 big outbursts of about 900 cases of SARS-CoV-2 from San Diego State that put the county back in danger of going into the purple zone and having to close back down. We are coming out of this now, and our hope is that we will continue to improve. And as you'll hear from Pierre in just a minute, so far, we aren't showing signs of heading in this direction. Let me turn it over now to Dr. Ouillet. Oh, I'm sorry, one more slide. This goes back to the rolling test positivity for San Diego County. This shows you 3 groups of people here on the San Diego campus. Students, employees at San Diego Health, and campus employees. The main point I want to make here is that we're consistently below as a community at UC San Diego, the overall San Diego County viral activity level. And this is the way we should strive to keep it. It really is a very good situation for us here on the campus. It also makes it much harder for people to raise concerns about UC San Diego being active in our research, our teaching, and our service activities. And now let me turn it over to Pierre Ouillet. Pierre?
Thank you, Chip. If we go to the next slide, I will share the dashboard that we have now put on our website so that the community can have access to it for a few weeks. What we typically show is the cumulative summary of number of tests performed and positivity rates, as well as a double click if you want on the last week for which the data is available. A couple of comments there. These numbers change very quickly. We are testing a lot of students, faculty, and staff at the moment. In fact, we are performing between 1,500 and 2,000 tests every day, which is a pretty staggering number. We actually have capacity to ramp up to over 3,000 today, and we'll continue to increase that capacity so that we can share it more with other communities as well. If you ask to ask me today, the number of students tested is now exceeding well over 11,000. And this number will continue to go up as we test every student who moves into the campus, as we have for the last few days. The other key numbers, of course, as Dr. Schooley mentioned, is looking at the positivity rates. They are low for the students. We are well below 1%, and I think this number will further go down given the good numbers that Chancellor Khosla shared with us earlier. My last comment is we keep improving as we speak. This dashboard will be further improved, hopefully early next week, and will be published on a daily basis so that we'll be able to track the numbers even more closely. Thank you. So happy to continue, Hallie. Let me step back and can remind everyone on about the Return to Learn framework and where we are today. Next slide. So just a reminder that Return to Learn is based on three major pillars. The first one is around risk mitigation, and it's about keeping the virus away from the campus as much as we can. So a number of measures there, and you are a big part of the solution. Hygiene, cleaning, sanitation, social distancing, of course, and face covering. And then a lot of work from resource management and planning, and my colleague Gary Matthew and his teams around building configurations and kind of physical improvements to the campus. So that's about risk mitigation. Then, of course, we want to detect the virus very quickly if there is any outbreak on the campus. That's why we are investing so many resources in both symptomatic and asymptomatic testing, which we also call surveillance testing. As I mentioned, we have a lot of capacity with a couple of labs fully producing on the campus right now. We also do environmental monitoring. That's what the Chancellor spoke about earlier, also called testing your poop. And it's a key way to detect if anyone is shedding in a building. And we are equipping a whole lot more buildings as we speak, so that by the end of the month, we should have 100 buildings and all of the residential ones fully equipped and monitored on a daily basis. And of course, we are lockstep with the county. And the final piece, once there is an outbreak or a positive case, is intervention. We have significant resources on every front. We have 600 beds that are purely dedicated to quarantine housing. Of course, we are using very few of them at this stage, but we want to be ready for anything. We have a large capacity as well for contact tracing, even if there were to be large outbreaks within our populations. We launched, as the Chancellor spoke about today, the exposure notification app, and I'll come back to that in a couple of slides. And we even work on molecular sequencing, which is a way to identify the strain of the virus to determine if outbreaks are linked or independent, and that's very helpful for our infectious disease teams as well. So I'll close this slide by just saying that I think what makes us unique is not every single of these levers, but it's the fact that it's a very comprehensive framework, and all of that combined is what is keeping us as safe as we can be. Thank you. I think I'll pass the baton to Dr. Scioscia, who is managing our student health services.
Next slide, please. Thanks, Pierre. I'm going to talk a little bit more. We're going to go one more on the daily screening process. I think I have another slide, which I'd like to do ahead of this. Yes, talking about daily screening, because this is a really important tool. This is actually your way of knowing your status for each and every day. It's also your access to testing and clinical guidance. And there are basically 3 simple questions you're going to be asked every day. From those questions, we'll identify that you don't have any symptoms, you've not been exposed, you're good to go, cleared to work on campus or work at home. If you've been exposed or someone in your household has this virus, then we want to help you with a quarantine process. People that have been exposed should stay in place. They also should have a test 5 days after they've been exposed to see if by chance they're starting to shed virus. It's important to realize with this virus, from exposure to potentially shedding is a window that's 14 days long. It's not immediate. Also, you may not know you're shedding virus because we know many people will be asymptomatic with this virus, particularly young adults. So we ask that if you've been exposed, that you will stay in place, not come to work. You may feel fine and continue to work if you're working remotely, but if you are working on the campus, you won't be able to come to work unless you're an essential worker. But then we'll want you to monitor for symptoms for a period of 14 days. And again, we ask you to test day 5, because that's a good chance of picking up those people who actually convert to shedding. Not all of them, but a good percent will know at that point. The third part is if you're having symptoms. You know, COVID-19 has a lot of different symptoms, more than just the fever, cough, and shortness of breath in the early phase. We know it can be fatigue, headache, a lot of different symptoms. So our threshold, if you have any of the symptoms, is to test you. We want you to stay in place, get a quick test. And with our COVID testing line and all of this testing sites that are distributed throughout San Diego, a combination of the health system sites, as well as on campus, we have the Price Center for our employees. So lots of places to get a test. You'll get called by the testing line. If you have a yellow or red thumb, you'll be offered a way to self-schedule a test. You'll have a test that day, and you'll have results back within 24 hours. I think that the fact that we have this access to testing and we have it back quickly is one of the key reasons for our ability to keep this as a safer campus than many other places have experienced. Let's go to the next slide, if we can. So I want to talk a little bit more about the periodic testing process for faculty, staff, and students. For faculty and staff, we're going to recommend that they avail themselves of this testing twice a week. This is separate from symptomatic testing. This is the screening testing of a community. And there'll be a link that you'll be able to self-schedule at one of these many sites. We want it to be scheduled appointments, not just walk up, because we want to make sure we have distancing and we're prepared for you, and we can track your specimen carefully and get your results back to you. Our students have a slightly different process. Because our students are young adults, by and large, they have a higher rate of asymptomatically shedding. We've also seen in our community, they've had a slightly higher positivity rate. So after a lot of careful consideration, we've decided that our students who are coming onto campus for whatever reason, to learn, for athletic events, for whatever reason, if you're going to be on this campus, we want our students to test. They'll be testing twice a month, no shorter than a period of 12 days apart, and no more than 16 days apart. This is the process we also recommend for our faculty and staff. Our students have been actively testing. We began with the students who are living on campus. The grads and professional students were testing through the summer. Those arriving after the 12th of August got tested within 48 hours of arrival. We began offering testing for our off-campus student community as well, because we know that those students have seen some viral activity. So we want to make sure we encompass our entire student body. The on-campus graduate, undergrad move-in is the big process many of you who are on campus right now are aware of. We've moved in over 3,000 undergraduates beginning this Saturday. It's been an amazing process of teamwork. Many people have contributed to this. our students get tested when they first arrive. They'll also be tested if everybody in their residential unit is present as well. So very careful process for the undergraduate, this large change in our on-campus resident community. We're really pleased with how well they've been doing. We expected we might see about 0.5% of these students shedding virus when they arrived. It's actually been much lower. In this group that started coming in on Saturday, the Chancellor hasn't even heard today's latest numbers. Nobody was positive this morning. So our rate is about, it's actually only a quarter of what we expected, about 0.133% at this point. It's really great. Our students have taken this very seriously, and as you've heard, they've been masking. So I think we all pulled together. We're starting out very well in the beginning. We have a few more to come in, another few thousand, but we'll continue testing. And by next Monday, most of the students who are going to arrive on campus will already be here and settled in. Next slide. I want to take a few seconds to talk about the flu. As you know, we now, flu comes up. We're moving into flu season. This is another viral infection with a respiratory component. So it's really important during the time of the pandemic, we want to keep people as healthy as possible. And we know that a flu shot, flu vaccination is really a very effective tool. It's not perfect, but it does reduce infections and influenza spread. So the university has executive order that requires all of us that are going to be on campus to have a flu shot. There's a lot of access for these flu shots. Under your health care, you can get it from your primary care provider. We also have the Price Center Ballroom. We're going to be offering this for our campus employees. I'll give you a lot more details in early October. We're working this out because we want to create some access for folks who are working evening, night shifts, weekends. So there will be employee flu clinics offered at the Price Center right here on campus. It will be by appointment only. You will need to stay there for about 15 minutes after your flu shot to make sure there's no reaction, which is extremely rare, but we want to be very careful and very safe. So you need to take a little bit of time from work to be able to get your flu shot at the Price Center, but we're there to support you, and we'll make sure that it's easy access for all of our employees. You also can use the drive-up sites that the health system has. There'll be 3 locations, La Jolla, Hillcrest, and Rancho Bernardo. You can make appointments for testing there as well. You'll be asked to document this through the work and health management tool. Thank you, and I'll be passing the baton on.
I'm going to come back and talk about the exposure app that the Chancellor introduced at the beginning of the conversation. And we're quite excited. The state made the announcement, when was that? 12 days ago, and chose 2 locations to be the test pilots for the state as a whole. And it's UC San Francisco in the north and UC San Diego for South California, which I think shows how highly this place is regarded by the state authorities. A pilot simply means that we are the launching pads. The app is open for everyone to upload, but the focus is on these 2 campuses at this stage. There are 4 things you need to know about the app. The number one thing to know is it is voluntary. You are making the decision to opt in. You can make at any time the decision to opt out. Number 2, it fully preserves your privacy. And what we mean by that is, and I'll explain to a little bit further, is that there is no identifiable information communicated to anyone. So you're fully anonymous through the process, and your location is never disclosed to anyone. There is no data that's being provided to neither UC San Diego or Google nor Apple. And the only information is encrypted pings from phones that are being sent to the state. And what it does is it notifies you if you're at risk of having been exposed to the virus. So the best way for me to explain it is to show a very quick case study. If we can go to the next slide. Let's hypothesize and talk about Alysson and Bob. They don't know each other. They are sitting on a bench in a park. They are less than 6 feet apart, and they are together and interacting for more than 15 seconds. The only thing they have in common is they both downloaded and installed the app on their phone. Because they did that, their phones, and because they're within 6 feet for more than 15 seconds, their phones exchange identifier through the Bluetooth technology to recognize the fact that they have been in close contact for a little while. And that's it. So then what happens, Bob goes home and unfortunately gets diagnosed with COVID. He has the option, which hopefully he will follow, to voluntarily enter in his phone a PIN that tells his phone that he was exposed to COVID. And what that does is this information is uploaded in the cloud. That's the only information. And it allows the database to identify every single phone with whom Bob has been in touch or close to over the last a few days. So if you go to the next slide. So what that means for Alice, who just went home and she wasn't aware that she may have been exposed, is that she gets a notification on her phone. A notification tells her that she may have been exposed and gives her some advice on what to do, probably quarantine, monitor her symptoms and get tested and get public health for support. And we have such support for those who need it at UC San Diego. So that's very much the way it works. If you go to the next slide, there was an email sent today to all the campus population. I did download the app on my iPhone this morning. It took me a couple of minutes. It's very straightforward. Just follow the direction. There are, again, two reasons for doing that. One is it really improves your chances to get notified if you are exposed and to learn of that. And two, if enough of the population was to download the app, it could actually stop the pandemic entirely. And I think there was a model done at Oxford that shows that if 60% of the population was to have the app active on their phone, the pandemic could be eradicated. So again, I couldn't urge you more to download it and be part of the community there. Thank you. I think let me introduce Vice Chancellor Gary Matthews now, who is going to speak about a lot of the measures being taken on the campus.
Thank you, Pierre. Over the last several months, facilities management staff have been working, one, to keep track of all the changing requirements and to develop signage. So across the campus, you will see a variety of signage giving people instruction on locations for testing, emergency operations, wearing one's mask is mandatory, and certainly the 6-foot distancing. So throughout the campus, you will see those signs. Please pay attention to them because they do change, as Hallie mentioned in the opening statements. When we have new guidance from the county or CDC or the state, often those signs will have to be changed to include the new directives. Next slide, please. What I'm showing you is a chart that was in part developed through the police department. They, through their uniformed security officers, non-sworn officers, no uniformed officers are involved in these reviews of compliance. We've shown that we've had close to 3,000 interactions with people who were on campus. They may not have been wearing a face covering or a mask. They may not have been doing the social distancing. And of those close to 3,000 or 2,500 encounters, all were resolved amicably. People were provided a mask and they elected to wear it. So there were no citations whatsoever provided during that time period. So that speaks volumes to the receptivity of our students and staff, as well as some of our neighbors, to do the right thing once they're made aware of the process. Next slide. One of the things that we have been noting is that we've got quite a few people who enter the campus who are non-affiliated. And what we're trying to do is provide a pleasant approach, if you will, by telling folks we're taking physical distancing to the max. If you are on campus, we hope that you will refrain from entering any campus grounds or buildings unless you have a university or business related need requiring you to do so. We're putting that on major entrances and across the campus because there have been concerns about folks walking across the campus without the proper face covers. Next slide, please. Some of the things that we've done throughout the last several months involve keeping the buildings clean and, most importantly, making sure that we provide you the very best opportunities for clean restrooms and clean facilities, whether it's public spaces, classrooms, offices. So we've adjusted all of our building systems, and we've eliminated the energy conserving measures, and we're using 100% outside fresh air to ensure that we get maximum airflow throughout the buildings. And we're doing that 24/7. We've increased fan speeds as best we can in terms of maximum air exchange. And we're also providing 100% outside fresh air with those increased fans. For the restrooms, we are fully disinfecting them on a daily basis, including all touch points and fixtures, and many high-use restrooms will receive multiple cleanings throughout the day. You'll also notice at the beginning, or the entrances rather, of major buildings, you'll see hand sanitizing stations. Many of our buildings have been retrofitted so that you have motion-free, activated building entrances, and we're trying to reduce the touch points in all buildings as much as possible. There will also be disinfecting wipes in the classrooms as well as laboratories. Next slide, please. So I'll leave with this. One of the things that we're also looking at from our operating perspective is to reduce touch points, reduce the density in buildings, and identify contactless pickup points where people can drive up or walk up and get orders that they may have placed in the bookstore or imprints or the public records office, and not have to come to those offices, which may be populated by staff that might be impacted if someone walks in who has the virus. So we're using a new service. Pickup point will start at Osler, and we're going to see how that progresses for the future. I'm going to end there because I know that you've got quite a few questions, and it's great to see close to 1,000 of you on this wonderful town hall. That's it for me at this point. Thank you.
All right, thanks so much, Gary. So next, we're going to be moving on, and we're going to have Pierre again. He's going to share some fall enrollment numbers, and we also have Alysson Satterlund, our Vice Chancellor for Student Affairs, to give us an update as we welcome our students back.
Thank you, Hallie. So quick numbers to give you a sense of where we are sitting right now with the fall enrollment. Number one is most of our classes are fully online. And if you look at the courses being offered, because they tend to be smaller, more interactive classes, less than 50 participants, it's about 7% of the total undergraduate course capacity. So it's an important takeaway. And number two is our undergraduate housing will be at about 45% of capacity, singles only. But a lot of students elected to still be with us, even though half of them and half of the ones staying with us in residence are going to be fully online. And we can hypothesize on why they decided to move and live with us, but better access to the internet, better social connections, and probably a safer environment as well in many ways. So that gives us a student population of about 11,000 undergrads that are going to have some on-campus experience, whether they live with us or whether they take at least one course with us. And the last bit of information is something, again, that's very unique to UC San Diego, which is we are highly relying on our students to keep each other safe, and we have hired 250 student health ambassadors to help with their peer education and enforcement. I think next is Alysson Sunderland, my counterpart in charge of student services.
Thank you, Pierre. So I understand how many questions we have to answer, and so I will move through this quite quickly, but I did want to share that we have been working with partners all over campus, with parents and loved ones off campus, and have been learning from our colleagues in higher education across the country the last several months in order to make sure our students stay engaged and healthy. I wanted to highlight a few things for you. So we have been using prevention, risk mitigation, community impact or reducing community spread, as well as inviting students to make a personal and community commitment. But first and foremost, our responsibility has been to provide resources to support our students in the desired behaviors. We also launched in spring quarter the virtual student union, where you'll find, if you're curious, hundreds of remote and virtual ways for our students to connect for fun, for health and well-being, for community engagement, sociocultural advising and activities, celebration. I also would encourage you, if you have programs and events that you would like to make available to students, we'd be delighted to showcase them on our virtual student union. I also wanted to highlight that Triton Weeks of Welcome, which also includes our welcome convocation, is launched this year. It's our collective effort to bring together all of the great work around welcome for graduate students and undergraduate students, and even new faculty under one umbrella. Many people across campus have been working to bring Triton Weeks of Welcome together, and I want to congratulate them and thank them for their effort to build community for our students remotely. And then also, while we were remote, we're really proud to have moved to Division I, and I want to congratulate Earl Edwards and Wendy Taylor-May and the entire team of coaches and athletes and alums and students who've been working the last several years to bring that to fruition. And though we are not in person to celebrate our scholar athletes, we'll keep you posted of the great work they're doing off the field. And then I wanted to also share, I put on the screen the yellow t-shirts for our Triton Health ambassadors. If you happen to be an essential team member and you're on campus and you see a Triton Health ambassador, I hope you'll wave at them and show some appreciation for them. Their work is really a celebration of compliance and friendly compliance. They'll also be providing free masks for students and visitors who may not have a mask, as well as providing gift cards to reinforce our students when they are practicing physical distancing, also masking, et cetera, because we know the individual behavior, as has been mentioned a few times already in this presentation, will be particularly important for our efforts to keep our campus as healthy as possible. And then finally, I wanted to share also that we have launched a campaign that's been student created and student directed around what's important for our students to create as daily habits, and also busting some myths around COVID-19 and reminding our students to also do symptom checkers. So thank you so much. And I wish all of you all continued health, and I appreciate the opportunity to share some of the work we're doing to engage our students and keep them healthy.
Thank you so much, Alysson, for that update. So now that concludes our update portion of our event today. So I'd like to welcome my fellow panelists onto the screen. We're going to move into our Q&A. So during registration, you had the opportunity to submit questions, and we got a lot. So we tried to kind of pick out the ones that were coming up the most. You can still submit questions during this portion of the event during the through the Q&A box. So yeah, let's get started. All right. So Alysson, I'm going to send this first question your way. Aside from the Career Center, which student service-oriented units will be delivering in-person services starting this fall?
So Hallie, that return to site plan is still in development. And we should have all of our information up on the site the first week of the fall quarter. And I'll be sure to share it with you also. You can make it available to our team members.
All right, good to know. All right. So a lot of us have been watching with some concern at the outbreak taking place at San Diego State and some other institutions. So maybe Pierre, you could share with us, how are UC San Diego's protocols different? What makes us different?
I think I touched a little bit on that in the earlier slide. I think it's a combination of things that we're doing. It's the layering of multiple initiatives. So, but if I was to kind of pick maybe 2 or 3 or 4 of them, the symptomatic systematic testing and the fact that the results are very quick to be provided back. I think that's very critical to detect an outbreak quickly. The wastewater, I think that we provide an additional layer of safety, and that's fairly unique. A couple of other institutions are doing that in the country, but it's pretty leading edge. But I think I would focus on student engagement as well, and Alysson touched on that. We have a very comprehensive plan. It was largely designed by our students themselves. I think we're relying on them and on their peers to keep their community safe. And the last one, which I don't think we speak enough about in the committee right now, is the fact that our plan is not just focused on students that are coming to the campus, but we are very focused on off-campus students as well, because our duty is to keep San Diego and the community safe and to keep them safe as well. And they will end up interacting with our own students as well. So, for example, if they need to quarantine themselves and they cannot do it in their residences, we will invite them to the campus to be safe and provided for.
Great, thank you. So Nancy, a question submitter said, I really appreciate having the December 31 date to work off. When do you think we'll have word about plans for next year? So Nancy, I'm wondering if you can share any information about that.
Yeah, absolutely. Thanks, Hallie, and I appreciate the question. So you'll all remember we earlier on, we had published information about expecting to stay working remotely until the beginning of September. And then we updated that information to extend for those who are effectively working remotely, and unless you hear otherwise, to extend through December 31st. I think that giving those time parameters has been very helpful for people to kind of make plans, especially around K through 12 school for kids and a whole bunch of other just personal reasons. And I appreciate how important that is. So I am very much expecting to engage in discussions with senior leaders so that we have, kind of so that we can reach a decision about whether we would extend that time, if so, by how much. And I expect that we will have more conversations and then decisions to be ready to communicate about that in about, I'm thinking will likely be about a month's time. I think there's a lot of things in play. We want to continue to work remotely to the extent we can to help de-densify the campus and in so many other ways. So I think it is a great question, and it's a question that is on my mind as well. And I will certainly share more specific information as soon as we have it. And if I may also just address a couple of additional things that are unrelated to this, but came up, and I wanted to clarify a couple things and just augment and amplify some of the information that Angela shared with us. So the flu shot is available at no cost for employees. The COVID-19 shot is available at no cost for employees if, in both of these instances, if the provider is UC San Diego Health. So we are not going to pay the cost of an employee going to get a flu shot at CVS. However, mostly in the community, flu shots are widely available and typically at no cost. That is not true of asymptomatic COVID-19 testing, and we do make those tests available both for our employees working on campus and for our employees working remotely as well. And the other additional clarification I wanted to add was that what we're expecting is that this will be done for the folks working on campus, that it's going to be part of their work time. It's part of compensable work time. And for the folks working remotely, the same is true. People may take time during their workday and drive up to one of the testing sites and get a flu shot and get a COVID test, and that would be part of the workday. So we're not looking at having people take leaves or need to do that outside of their work time. So thanks for letting me just add a bit more additional clarification on that as well.
Great. Awesome. Thank you, Nancy. So Alysson, I'm going to send another question your way. Will student organizations be allowed on campus in the fall? And what are the plans for student groups and how they're going to meet?
So there are no fall 2020 events, and the county recently released guidance around a gathering as one plus another person in a non-family group. It's really important to remember. With that in mind, just to ensure the slow of the spread and keep our community as safe as possible, we are advising all of our student clubs and organizations to engage with each other remotely, just as they've been doing over the summer and also over spring quarter. And we've made available a virtual student club and organization fair as part of our Triton Weeks of Welcome, because we know engagement and community and relationship are really important to our students. So you'll see them remotely and virtually.
Great. It's great to hear that they're still going to be active, just not in person. Awesome. All right. So Angela, this next question's for you. Based on your return to learn plans, are the containment and detection numbers in line or higher or lower than we expected?
Actually, I'm happy to say they're lower than we expected. We planned for a little more viral activity with these young new undergraduates coming onto campus, and it's actually been quite low. So I think they've taken this very seriously to keep themselves safe before they got here, and we are pleased with the process. As the Chancellor mentioned, we did pick up 2 individuals who were shedding virus without their awareness. We were very promptly able to put them in isolation. And so I think the process is working well. We're encouraged. We still have a few thousand more to get through, but the preliminary results are wonderful. We're very happy.
That's great news. Thank you for that update. Okay, so Gary, next question's for you. And the submitter wrote, Gary, I know you keep getting this question, but things can change. What face coverings is the university not going to accept on campus? Or maybe if somebody else would like to jump in about our mask and face covering policies.
I think it's important to realize with a face mask, to be effective, any covering really has to close and seal off the area. So a loose fitting, a loosely woven mask a covering like that doesn't really help you. The point of wearing it is to actually keep your nose and your mouth sealed off so that the breath that you have, that if you're shedding, doesn't shed virus out. Similarly, it protects you from inhaling virus. So a tight fitting face covering so it needs to be relatively tightly woven and tightly fitting. Those are the basic guidelines. I don't know if anybody else wants to add any more to that.
Any of our panelists have any additional thoughts? Well, all right. Okay, moving right along. Here's a quick question. Do we know, is the farmer's market coming back? Does anyone know the answer to that question?
At this juncture in the fall quarter, the farmers market will not be coming back. And we hope to have it back maybe in the spring, but at this point, we're not sure.
Right. So no for fall, and we're looking potentially for next year, maybe.
Correct. It's become more a food court, quite candidly, and a very positive one than a farmer's market. And there's some implications for conveying the virus with food.
Sure, makes sense. All right, so our next question is about the flu shot. And the question is, why are we required to get a flu shot this year? And I have that question too. So, what is different about this year? What is the interplay between COVID and flu shots? So I'm wondering, Chip, if you could answer that for us.
Well, there was concern that influenza and COVID have overlapping presentations in some people. They're not identical diseases, but in an individual patient, you often can't tell the difference. And so the hope was we would have less influenza so that there would be fewer people who would have to run and get tested for COVID and be worried that they might have COVID. We don't, in fact, know what's going to happen with influenza this year. It's possible we'll have a very light influenza year because we're all wearing masks and being distanced. And it's been shown already in Brazil and in Australia, where it is now winter, that the influenza season was quite light. I'm not discouraging you from getting influenza shots. I'm in fact encouraging you to do it, but I also want to be honest with you. I am hoping that the distancing will also make influenza less of a problem this year.
Great, thank you. All right, so also along the lines of flu shots, a participant today says, I already got my flu shot this year. Do I have to verify that? Where do I go to share that information? And I'm wondering, Nancy, if you can answer that for us.
Yeah, I'd be happy to. We're going to be using it's just an attestation. So employees will just say, yes, I got a flu shot. And that will be part of the work health management tool, which is where you went to register in order to have your setup for your daily symptom screening. So we're still finalizing the kind of final technology to make that work, but that would just simply be an attestation, again, that you have gotten the flu shot, and it doesn't have to be from a particular provider or anything like that. And it's required, again, by Office of the President for folks coming onto any UC physical location.
Cool. So what I'm hearing is you don't have to print out some kind of paper if you went to CVS and got your flu shot. You just need to say that you did it.
Correct.
All right,
Yeah,
great.
thank you.
So another flu shot question. My religious views don't allow me to get a flu shot. So what do I do? How can I get that accommodated?
Okay, may I speak to that as well, Hallie? Is that okay? Yeah, so yes, there are provisions for exemptions from the flu shot requirement based on medical reasons and also based on religious reasons. We would handle the medical reasons through DCC for campus staff and for campus faculty as well, consistent with the way we handle requests for accommodations generally. And then in terms of religious accommodations that are being requested, those would go to Terri Winbush and her team within Human Resources. The Employee Relations and Labor Relations team would handle those requests for staff.
Great, thank you. All right, so earlier in the presentation, Gary gave us some information from our security and UC San Diego police about, when they're encountering folks who maybe aren't following these safety protocols. So my question is, how will we respond to instances when COVID safety protocols are not being followed? For example, someone wearing a mask, and I think this question means like in the workplace, like maybe a colleague who might be doing this. So I think Terri, is that something you might be able to speak to?
Sure. I mean, I think the first thing that everyone should understand is we take these safety protocols very seriously. And so to the extent that someone is not complying with those safety protocols, we will act accordingly. We have different processes that we work within for employee relations and labor relations to ensure that people are behaving in compliance with all safety protocols, not even just the COVID-19 safety protocols, as you can imagine, across the campus. So I would just say that follow the rules and we won't have to engage in those discussions. But if you don't, we will have appropriate conversations about what the next steps need to be regarding that.
While I have you, Terri, another question for you. Will the paid admin COVID leave be extended beyond December 31st, 2020?
At this time, we don't have any information that they are being extended. People should also recognize that while some of these leaves, or our Chancellor supplemental leave, for example, that's a local leave, the other leaves are system-wide leaves and federal government FFCRA leaves. So we would have to take our cues from system-wide as it relates to paid admin leave. And then for the federal leaves, we'd have to understand from the federal government that those leave availabilities will be extended. We haven't had that information yet, but once we do, we'll make sure that everyone knows what's available.
All right, thank you, Terri. So the next question, I think Pierre might be able to answer for this. When will decisions be made in regard to winter and spring quarter? So we're hearing about the fall quarter and what we can expect for that. What about winter and spring quarter?
So at this stage, the base assumption is that the winter quarter will look very much like the fall quarter, and that's the planning assumptions for the academic divisions who are taking the lead. Of course, we'll learn a lot over the next few weeks on how the campus is doing, and we'll do what we have done so far, which is continue to adapt with the pandemic and with what we learn. But my base assumption at this stage is that the winter will look very much like the fall. And the spring feels like light years away,
It does. September felt like light years away in March, and it doesn't feel like that anymore, does it? All right. So the next question I'm going to send over to Chip. So will there be a transition to saliva-based COVID testing in place of nasal swabs? And if so, when?
So we're anticipating having that happen for students first. Dr. Rob Knight has already, to get to another question, taken the Yale test and adopted it, and is getting very good results with it, with sensitivity at least as great and perhaps greater than theirs. There's a process you have to go through to compare it to a test that's already ongoing in your hands before you can offer it as a clinical test, and he's in that stage right now. So I think our goal is to get this saliva testing, we hope, during the month of October.
Great, thank you for that update. All right, so Angela, I'm going to send this one your way. How often should I get a COVID-19 test if I'm working remotely full-time?
A recommendation is that you consider the twice a month testing as well, even though you're remote. And of course, have symptoms, then right then and there. You always want to get testing anytime you have symptoms fairly soon. And so we don't limit that to only twice a month for anyone. Similarly, exposure testing, we try and time that with the high likelihood when people start to shed virus after exposure, even though there's this very long window. That 5-day number is 5 day after exposure is a pretty good number to test again, because if you've converted, we want then to make sure your contacts are notified and you get the right instructions, because isolation for when you're positive with virus is a little different than quarantine. So there is testing in a couple of ways. Again, the asymptomatic twice a month is a good way to follow, symptomatic, and then along with exposure. So quite a bit of testing is going to be happening. We're kind of fortunate to have all this testing. I think when Pierre mentioned how important testing was to our platform and our ability to keep everybody safe, this is really true. We have really great access to testing and prompt results. Helps us a lot.
That's great. Thank you, Angela. I just wanted to mention, we're going to be taking our Q&A until 4:15, but I did want to say just a special thank you to Alysson Satterlund, who has to drop off of our town hall just a little bit early, but we'll be continuing for another 15 minutes. So if you're able to stay, we would welcome you to do that. All right, so another question about testing. So what are the guidelines for retesting patients who test positive for COVID? So maybe Angela or Chip.
Right now, we're not recommending people who have tested positive to be retested before they go back to work. The data that we have seen is that the infectivity period is really maximal at the beginning of your exposure, and that if you are symptomatic, by 3 days after your symptoms have resolved or 10 days after your initial presentation, you can go back to work quite safely. One of the issues that is confusing is that the test that we use is extremely sensitive and can be positive for up to 2 months after a bout of infection, but coated with antibodies, it is not transmissible to other people. So it just causes confusion. The CDC used to recommend either testing or time to go back to work, and now basically the time-based back to work guidelines are what we're using around the country.
Thanks for sharing. All right, so next question, also related to testing. I'm going to send this your way, Terri. If I'm working on campus and I test positive, what needs to happen before I can come back to work on site?
You need to first contact COEM to get guidance on your positive testing. They probably have already contacted you and given you guidance if you know you're positive. But the main thing you need is a return to work note clearing you to return to the work site. So if that's with your primary care provider, they can provide you that note. If that's with COEM, they can also provide you that note. But we want to ensure that you're safe to return to work before you do so.
That sounds like a smart plan. All right, so next question. And Nancy, I think this would be a question for you. What are the plans for the last 2 weeks of December? We usually close the campus between Christmas and New Year's. Will we do that again?
Yeah, so we typically have a winter holiday curtailment that's very consistent year to year. And that's actually the plan that we have in place at this time. So specifically, we would be looking at a closure of with 4 paid holidays and 3 what is sometimes called curtailment days, or days in which employees would use vacation and not work. So 4 paid holidays would be December 24th and 25th, and then 31st and 1st. The vacation days or curtailment days would be December 28th, 29th, and 30th. And this is very consistent, as I say, with the way we look at this year to year. It depends on how the holidays fall on a particular calendar, but essentially that's what we are looking at doing at this time.
Great. All right, Pierre, I'm going to send this next question to you. How will UC San Diego continue affording the cost of business and COVID? Are furloughs or layoffs being considered?
It's a multi-layered question. So the first part is, keeping everybody safe and continuing our mission of teaching and research and patient care is not optional. So we do what we need to do, and we worry about the cost later, quite frankly. So we're not going to cheapen on tests or support for our employees and faculty and students, period, ever. Having said that, we have budgeted fairly significant costs, but they are kind of one time during COVID for testing, for example. The cost for these 2 quarters is likely to be in the $10 to $20 million range, and that's kind of fully budgeted. So that kind of answers the question around, can we afford it? The answer is yes, and we don't have a choice. That's what we do. In terms of kind of financial impact, again, we have budgeted for that. I told everyone in the previous town hall, and I repeated today, that we are exactly where we wanted to be financially. We anticipated the state cuts appropriately. We anticipated the cost of COVID appropriately. We haven't seen any drop in enrollment. We are very sought after institution, and we're very fortunate that way. Tuition would be the biggest revenue impact, and we haven't seen any impact whatsoever. So my guidance to everyone is the budget that we are put in place on July 1st will continue to apply. There will be no further budget cut this year. I'm not working on any budget cut after that, but I cannot commit for the long term. So units that have managed to absorb mostly through attrition, their budget cuts are fine and shouldn't worry about at least the near medium future from our perspective.
Thank you, Pierre. So Chip, earlier you mentioned something about antibodies. So I'd like to know, will antibody testing be made available more broadly at UC San Diego?
The clinical laboratory does have the assay to do an antibody test. The issue really is what you would use it for. We know that most, but not all people will develop antibodies within the first 2 to 4 weeks of their acute infection. But they don't generally have antibodies at the time they're developing symptoms. So antibodies aren't helpful to tell you that someone is infected and needs to go home, as, for example, a nasal swab does. The antibodies also go away quite quickly, and some people are gone as soon as 3 months later. And so if you're trying to find out whether that illness you had in February was COVID, an antibody test that's negative now doesn't tell you that it wasn't. And we're also now seeing people who were infected in February and March getting reinfected with a new strain. So, and many of them had antibodies at the time of their initial infection. Not all of them have it at the time of reinfection. This virus is one that, for reasons that no one understands, has immunity that starts waning very quickly after your infection. And that's one of the reasons the virus comes back in the human population. There are cousins of this virus, other coronaviruses that cause common colds. Those viruses come back every 2 to 4 years in the general population without bothering to change much genetically, because the immune response doesn't last long. So the antibody tests are mainly useful if you're an epidemiologist trying to see how many people last month in San Diego were infected, but they're not that useful for managing individual people, which is why we haven't added it to our screening program.
Great, that's a great answer. I just feel like I learned a ton just now. That was awesome. All right, so Gary, in your update portion, you mentioned some of the ways and some of the steps that are being taken through your unit to ensure the safety of essential staff members on campus. And I'm wondering if there's anything else you can share about things that we're doing to our campus to protect our essential on-campus workers.
I think what's important is that we embrace best practices, and most importantly, we're working with our faculty and staff who are on campus, who have some of the best backgrounds and knowledge to develop those best practices. Much of what we've done has been changing over the last several months. We're not set in our ways as much as we're really trying to make sure that we maintain a safe environment. So we're adapting, pivoting. Pivot's a word that's been really essential these days in the COVID period, and we're adapting. We're also working with a team of interdisciplinary faculty from SIO, engineering, computer sciences, and the Cal IT Institute to really look at our air handling systems, and most importantly, look at the building controls and identify what opportunities we have to use existing building controls to manage the airflow in the building, as well as to also look at, for instance, occupancy. We are looking and working with our IT colleagues to identify opportunities similar to the app that was mentioned earlier, where no individual information would be taken, but pings or identifiers from cell phones could tell us, for instance, that we've got 50, 60 people in the library. So there has been an application that our students have been using for several years that was developed by an alum. And I think it's the Waze. It went from OccuSpace to Waze, but clearly it's the use of technology to identify building density and to identify a host of other opportunities for managing the buildings. So we've been working very hard with that. We're not at a point where we can announce other than, for instance, the occupancy sensors and options are going to be there shortly. We've also worked with the night lab to identify locations for the wastewater treatment or handling. We've been handling wastewater in facilities management for decades in terms of testing it to make sure that there were no additional chemicals going into the system, as well as bacteria or viruses. And I think our teams have been working collaboratively, and that's what makes this work. It's the collaboration across many disciplines with really great subject matter experts.
Great, thank you, Gary. Okay, so our next question, the submitter says, dealing with the systems changes from Oracle and UC Path, especially with everything else going on, is really putting a strain on my department. What can we do to help? So I think maybe this has two kind of answers. So I'd like maybe to hear from Pierre first as our CFO, but then I'd also like to hear from Terri kind of from that employee relations sort of lens. So Pierre, what are your thoughts on that question?
So first of all, I do appreciate there is a lot going on and there is a lot of stress and people are working really hard. And I think many may be surprised to hear me say that, but considering the experience of other campuses, even our UC Path transition has gone remarkably well. But yes, there are outstanding issues. People have to get used to the systems. It took a little while to get access to data and so forth. So I fully appreciate the questions. I think what people can do is two things. Really reach out to their business officers, and we have a community of practice. So we put in place what we call the hypercare network, which means we have peer groups with escalation to our experts that are ready to solve issues. So please go through your business office first, because they should be able to know whom to reach out to. If you still get stuck, please escalate to any of us, and we'll always put you in the right direction and make sure that help is on the way. And two is, I know it's hard and it's easier said than done, but be patient with one another a little bit. People are still learning and adapting, and try to be kind of graceful about it. But if anybody gets stuck, reach out to any of us, and we always find a way to help out.
So I will just amplify what Pierre said. Please show yourself grace. It is okay to be tired. It is okay to be stressed. It is okay to have anxiety. What it is not okay to do is to ignore those things and not take care of yourself. And then once you take care of yourself, you can offer, assistance to others and show them grace, right? Lead by example. Take vacation time. Take a break. Re-look at your priorities. For you managers and supervisors out there, everything can't be done by tomorrow, and it won't. Break the building if it's not done by tomorrow. So reprioritize. Rethink what really, really needs to be done by tomorrow and by next week. What things can be put off to next year? Let's think about this all as an organization broadly, so we can get through this really challenging time together. I've seen, extreme resilience in a lot of our groups, and I know that we can do this if we stick together. But the main thing is take care of yourself. I cannot say that enough. Deprioritize. I cannot say that enough.
Right. Thank you, Terri. Sage wisdom and advice. So we're approaching 4:15. So this is our last question. And Nancy, I'm going to send this one to you. How can we encourage leadership to support working remotely even after the crisis has subsided?
Sorry about that. That is a really important question. As we look forward to our future, as we look to be an institution that stands for innovation and stands for the employee value proposition and is the employer of choice and has highly flexible workplace that looks at work-life balance and meets employees where they are and recognizes the whole person. We have a great opportunity to learn from this forced experiment in working very differently, to see how we can work very differently. How can we have connection? How can we have productivity and accountability and collaborate and see each other and support each other? How do we have teamwork in a virtual environment or in a hybrid environment? So I'm leading a task force that is kind of representing folks across VC areas to look at all of these questions. It is a very exciting opportunity for us to really think through and innovate and look to, how can we learn from data from our own institution and from peer institutions and from best practices across other types of employers. The survey data that we have, as I mentioned, that preliminarily been looking at from the Staff at Work survey is going to be very valuable to us. We looked specifically, we augmented the survey questions, as you all who took the survey will remember, to really get at some specific questions about the remote work experience and productivity and how are supervisors viewing productivity, not just how are employees viewing their own productivity. What are people finding satisfying? What are people finding frustrating? So I think we want to be an exemplar of environmental sustainability, and how might that be different? And so we can and will have an opportunity to really be informed about, we've kind of blown up a lot of our assumptions and stereotypes. I know that that's true for me. So I think that we have a great opportunity ahead of us to really look at working in a way that makes UC San Diego a vibrant community, a community where it's the best possible place to work, and that's why we all work here.
Well, I think that is a great note to end on. So I want to say thank you to everyone for participating today. That's all the time that we have. We'll be attempting to answer some of the questions that we didn't get to in the Q&A and posting responses on the Return to Learn website. So I encourage you to check that out.